The Center for Orthopedics and Movement has integrated multiple different specialties, including core orthopedics, the physiatry department, rheumatology, neurology, podiatry, as well as acupuncture. Above and beyond that, we also share the space with Exeter Hospital's entities, which is physical therapy, outpatient therapy, aquatic therapy, and massage. Having the ability to integrate the Center for Orthopedics and Movement and bringing all these specialties together under one roof has been a huge benefit to our patients. They have all the resources they need under one roof. If you come in and see core orthopedics and then you need a referral to rheumatology, the providers can have conversation with each other. They can bring in a care team with PT as well and integrate the whole care plan for you.
My role at Core Physicians is I'm the practice administrator of the podiatry, neurology, acupuncture, and call center offices. I think I was most attracted to Core Physicians to work with physicians and clinicians in a freestanding building that's kind of a one-stop shop for patients. I loved the idea of having a patient be able to come in to be seen for an orthopedic visit, have an x-ray, and maybe have an order from their primary care doctor and have their labs drawn all in the same day.
I started with Core a little over about 7.5 years ago. So when I was initially looking at positions, I was more interested in an environment where I would feel comfortable with the people I was working with, both from an administrative standpoint and other personnel. We have a lot of patients that have physical therapy and occupational therapy needs, speech therapy needs, and so having the rehab right here at the center is very helpful.
I've been working with Core Physicians for 8 years now. I came here straight out of fellowship and this has been my first job. I chose to practice with Core because initially I was just drawn to the area. I knew I wanted to work in this area, and so I looked at practices around here, and Core was really attractive in just the type of practice and everybody that was working here, and so it's been a really good place to work. I think Core is set apart from other healthcare organizations because it's really unique for a community hospital and a community practice to have such great care, and we're really kind of like academic level care in a community setting, so it's a really unique kind of practice in that way.
I've been a physician assistant for 2 years. I worked at another hospital, another community hospital in New Hampshire prior to coming to the Seacoast to join the Core Orthopedic Department. What attracted me to Core was the variety of specialties that was encompassed within the group and the different training backgrounds that each surgeon had, and the location in the state of New Hampshire is about as good as it gets.
I think, if you're a doc considering coming here, I think you have to realize that the people who do work here are all very caring. I think there's a very collegial component to the organization where everybody is friendly to each other and interact as a group very well.
So for any physicians that are considering a new practice or looking at joining Core, I would say that it's really a great place to work. I've been very happy for the 8 years that I've been here. I feel very supported, and again, I think the biggest thing for me is the work-life balance has been great, and it's just a great collegial place to work.